Okay, well, with that then, why don't we get started? Hello, everyone. Thank you for joining. We will, as I've noted, we are recording this webinar and we'll be sharing replay links afterwards. If you do not want to be part of the recording, please exit the webinar now. I hope you can stay, but it's your personal choice. And now we'll start with introductions. Before that, I'll just say today's webinar topic is ensuring safety for frontline human services workers. I'm Mike Forbes. I'm the senior subject matter expert on safety for Vestige. And I've been in the mobile technology space for over 20 years, working with government and other types of organizations. And I've had the lucky opportunity to work on such diverse projects as worker safety, like we're talking about today, public health disease modeling and field data collection funded by the CDC. And probably still the highlight of my career is I was part of the project team on the GPS-based evidence collection app used by FDNY firefighters at Ground Zero in the aftermath of the 9/11 attacks. And that app, I don't think we called them apps back then, but that application won the ERISA Exemplary System in Government Award that year. I've been at Vestige for 9 years now, and I had the great pleasure of launching the solutions we're talking about today here at Vestige. I'm going to mention a couple other folks right now. We've got Ariel Eaton. She is the director of marketing of a company called EcoLane, which is one of our sister companies. I'll get into that briefly in a moment. And she's going to be my co-host. She's going to be helping with Q&A, keeping things moving smoothly. Thanks, Ariel, for your help in advance. And we also have Bree Lane as our featured speaker, who will share insights on frontline workers in the field. I'll give her the full introduction when we get to that part of the presentation. And again, thanks for joining. With that, I'll set the stage here. We all know we live in a volatile world, but I think people in general don't understand how challenging the health and human services professions can be. Here are a few quick facts that set the stage. Nurses, and I think we can generalize this out to all human services workers in the field, rank just after police and firefighters for rates of injury and even death on the job. And human services workers are 5 times more likely to face workplace violence than the average. And you add to that there's believed to be a great level of underreporting. So this issue may be much larger than the public realizes. I'm sure you realize. And again, with 20 million people in the healthcare and social assistance industry sector, it's clear this is an enormous issue. Now we'll start with a little bit about Vestige. Vestige is a 10-year-old company focused on a wide range of safety solutions with government customers on the state, county, municipal, and tribal levels, plus all manners of nonprofits. Vestige is a member of the Transit Technologies Mobile Alliance, which offers a range of solutions to government and healthcare and other industries. And the Transit Technologies is a group of 9 complementary companies with the mission of improving the quality of life in our communities with safe, effective, and reliable solutions for all using innovative technology. At Transit Technologies, we connect communities, empower individual journeys, enhance access to healthcare, and revolutionize mobility. Our cutting-edge solutions shape the future of transportation, seamlessly blending technology and transit to create a more connected, accessible world. Vestige's contribution to the Alliance is in providing solutions that increase the safety of workers in the field and on our roads. And with that, I'd like to introduce Jerry Leonard, the CEO of Transit Technologies, who will welcome you and share some thoughts on worker safety.
Thanks, Mike. Well, you did a great introduction there. I was actually very proud. I was just beaming listening to the mission there. Yeah. So Thank you all for joining. Very, very thrilled to have so many of you here tuning in to listening into what we can do to protect worker safety. As Mike said, we're part of a group of software and hardware companies that are designed to really just improve the quality of life. And, you know, when we got into the transit space and we work with fixed routes and paratransit, non-emergency medical transportation, a whole host of transportation solutions, we realized that safety was very quickly coming to the top of the stack as far as challenges that needed to be addressed. Just on the roads last year, there were 46,000 people who were killed. The amount of serious injuries is incredible, and it's been getting bigger and bigger since COVID. It's crazy. So we fit a lot of these vehicles with artificial intelligence, so we know what the drivers are doing, if they're distracted, if they're driving too quickly, if they're taking harsh braking and cornering. And to me, that's a case of saying, hey, what can I do to protect my family on the road? What am I doing to help other people on the road to make sure that they can have a safe experience? And it really does put it top of mind when you have a personal experience with somebody who's been impacted by a safety issue. And it's inevitable, we're all going to get impacted by it at some point. So when we started talking more about road safety to our transit partners, they said, hey, what about our drivers? Our drivers are now more and more experiencing assaults on a regular basis. I listened to the CEO of New York MTA talk about how many assaults have happened on drivers and people on the platforms and train stations in New York. Thousands of assault issues every year. And again, to Mike's point, probably a lot of them going underreported. And they said when they did the diagnosis, they realized that many of those issues were caused by mental health issue by victims, by the perpetrators with mental health issues, and they were repeat offenders over and over and over again. And they started tying a lot of the issues to mental health issues. So to that point of it being of May being Mental Health Awareness Month, it's obviously a great time to talk about this. It's really becoming top of mind everywhere you look. My brother is the head of safety for a utility company in the southern United States. And he said it's a board level presentation every month to talk about how many issues, how many incidents, and how many near misses, and what are the reporting, and what can you do to attack the underlying issues. And it comes down to, you know, what are we doing about risk assessment? What are we doing about prevention? What are we doing to use technology to report and help alleviate some of these issues? So as we think about what your people do in the front line, obviously we have an enormous amount of respect for what you do in frontline work, in your frontline work every day. You're trying to do what you can to keep the community better, to get out there and help people who might be housebound, or anything you have to do to ultimately improve the quality of life of the people that you serve. And you don't want to have that additional risk of having a potential issue that you're going to be facing too. So the way I think about it as a leader, as the CEO of my organization, it's my responsibility to look after my people as best I can. And I think as leaders, we all have that responsibility. We have to set the tone and the culture at the top. What am I doing to make sure that I don't have to make a phone call to one of my frontline workers to tell them that something has happened? Have I done everything in my power to make sure that that didn't? That I had done everything I could to make sure that wasn't an issue. Again, my team generally is not in the same position as yours. They're technology geeks, or they're finance geeks, or whatever. They're not doing the kind of work that you guys do. But I think we all share this responsibility of my job is to look after my people as best I can. And I hope you take the same amount of responsibility in what you're doing. So I'm thrilled that you're here. I know it's a big, big issue, and the good news is there's great technology out there. There's great tools to help you do what you can to make sure that you're protecting your frontline workers. So with that, I'm going to turn it over to Mike. I also want to say a thank you in advance to Bree from Telecare, who'll be sharing her firsthand experience with using Vestige technology. But again, thank you for joining. And Mike, I'll let you take it away from here.
Thanks a lot, Jerry. Great stuff. Thank you very much. So now let's get started with some housekeeping and the agenda. First off, to ask questions, you can put them in the general chat or the Q&A chat, and we will address the questions at the end of the webinar. And with that said, here's what we're going to cover today. First, we're going to look at a quick review of the risk environment faced by frontline workers and what the people doing the actual work, think about these risks. We're also going to look at some potential ways to mitigate the risks. And then we'll learn from the experience of Bree Lane, who's joined us from Telecare and the San Diego Mobile Crisis Response Team program. And here's a warning statement. I'm not going to mention any of the recent high-profile incidents that ended in tragedy. I believe we're all too familiar with events like that, and they don't need to be shared here for any sensational purposes. And as a final note, before we get started, I've relied on a number of sources in preparing this presentation, and I'll share them by email with the attendees after the presentation. So here we go. Today, we're going to explore the safety changes and some solutions for workers who are engaged in helping others. We'll be talking about people in fields including behavioral health, homelessness, human services, child and family services, and extending that out to visiting healthcare workers, including visiting nurse and hospice. They face similar challenges in the field. And, the commonality is that all of these professions, the people are stepping up to help when their clients are often at their worst, from mental illness, poverty, addiction, homelessness, justice system involvement, unstable family environments, and even facing the end of life and more. Another commonality of this group is that much of the treatment takes place not in traditional healthcare facilities, but in the street, in the field, inside clients' homes. All of this comes together to create a situation that can put these workers at risk. And now I'm going to review those risks, what people think about them, and some potential ways to mitigate them. And as a final note, as we get started, I've already said that one, sorry. So just some quick facts, and then we're going to go into detail. Social services workers, it's the 20th most dangerous job in America. And as I mentioned, comes just behind police and firefighters in terms of workplace injury. And workers are 5 times as likely to suffer a severe workplace injury than workers in other sectors. And again, we're not going to talk about the numerous high-profile incidents I'm sure everyone is aware of. And I'll just add one last thing. This is sort of anecdotal, but we've been hearing it from customers that with the emergence from COVID, the world has become more volatile with more aggressive clients, more aggressive family, and more dangers to people in the environment. I don't know if you've all seen that, but that's something that has been reported by a lot of our customers. And now let's look at some specific risks and some specific numbers. Threatened by weapons. 45% of people in social services have reported being threatened by weapons. I'm sorry, exposed to weapons, with 9% being threatened. And let me just step back and say, this is based on a survey of over 1,000 professionals in the field. And again, that's one of the source items I will attach after the call is over. So 45% exposed to weapons, 9% threatened by weapons. 64% of field workers, frontline workers, report being verbally assaulted by clients, and 64% report being verbally assaulted by family and friends. 3% have been physically assaulted by clients. 3% have been physically assaulted by family and friends. 21% felt their life in jeopardy. And, thinking about that, 21% have felt their life at jeopardy. I can't even think of a single instance in my life, and I've been a professional inner city EMT at one point where I felt that. So, the level of danger that people are feeling is very high and very concerning. Moving on, 36% have been involved in altercations in neighborhoods, and which is not surprising that 60% have reported going into feared neighborhoods. And I'll end this with a couple more facts. 60% have been bitten or or chased by an animal, typically dogs, and 39% have encountered drug deals and drug dealers in the nature of their work. And with that said, I mentioned underreporting. It's widely believed in the literature that workers are underreporting the amount of incidents that happened, and this may just be the tip of the iceberg. Some of the reasons people have given for not reporting: they accept the risk as part of the job. Their organizations have poor or non-existent policies, procedures, or supports. If they do have programs, those programs can be overly complex and creates a disincentive for reporting. And there's, I guess, a concern that's been reported that violence happens so frequently that it's time-consuming to report every incident, in addition to a lack of response when time is taken to report. So they're not feeling like they're getting any results from this. And the last is actually two more. One is people don't report incidents for fear that reporting will reflect poorly on their job performance, and the belief that some patients cannot be held accountable for their violent actions, which, in thinking about behavioral health specifically, that is a key comment. So with all that said, it's no surprising that 97% of respondents believe safety training should be mandatory before new staff go into the field. I'll talk about some other things we can do for safety, and Bree will elaborate on that momentarily. So, sum it all up, 57% of workers have experienced at least some violence in their careers. Total of 64% report having been assaulted. More than half are worried about their safety. 30% felt they were unprepared by their agency before being sent into the field, and 30% felt their supervisors did not address safety concerns adequately. And I'll leave this with an anecdotal thought as well. This is something that one of our longtime customers, in behavioral health, the director of HR said to me. He said that he heard two things in every exit interview: "I don't feel safe, and I don't feel you," meaning his organization, "are doing enough to keep me safe." So employee retention is another issue that needs to be addressed or considered as part of the whole safety field. And now I'll briefly talk about the SAVE Act. I don't know how many people have heard of this. This is HR 2584 in Congress, and it's a bipartisan bill with over 100 co-sponsors as of last Wednesday. And it makes it a new federal crime to knowingly assault or intimidate healthcare workers in the performance of their duties, and authorizes new anti-violence grants. I'll share more information about this, but it is something being done at the federal level to help facilitate the safety of your staff in the field. With that said,
so sorry. And if anyone has had any of their own experiences with any of the topics that Mike's been discussing, if you'd like to share that in the chat, we would love to be able to discuss them at the end of the webinar.
Thank you, Ariel. Well, now I'm just going to go briefly and talk about the Vestige PERSA lone worker safety, field worker safety solution. It's been deployed in numerous use cases in its approximately 9 years in the field: lone workers, visiting and public-facing workers, crisis stabilization teams and outreach workers, and even safety for facilities. We have these in numerous residential facilities, cool-down facilities, healthcare front offices, behavioral health and mental health offices, where it's even used by practitioners in counseling rooms. And again, it is a solution strongly dedicated to worker safety. And to Jerry's earlier point, we've just rolled it out with one public transit agency in Ohio, using it for their bus drivers who were facing assaults. And, you know, we've also deployed it with one state's driving test evaluators for worker safety. Although it makes me wonder, I mean, if you assault your driving test evaluator, that's got to be an automatic fail. But anyway, enough jokes there. Talking about the solution, it is a wearable device, and it's a dedicated device. It has everything built in to do its job. You don't have to pair it with a phone. You don't have to hook it to a network. It's a dumb little device that automatically connects to its network and does what it does very reliably and very effectively. We've got the personal duress button, the panic button, the SOS button, whatever you want to call it. When a user presses that, and it's typically a press and hold for 4 seconds, and a buzz, because it is a silent alarm, will then send out alerts by text message, by email, and I'll get into what else we do, but I'm going to add before that, that the silent alarm function is a very important function. Something we've learned from probably all of our customers in the field is that the very act of trying to request, you know, police help for a situation can be provocative and may even be a violence trigger for some users, where the ability of having a device that allows your user to silently and discreetly request help, that gives your person more control of the situation. They can de-escalate, they can get out of the situation, whatever your protocol is, but the situation has not been pushed to the edge like it would be by whipping out a phone or talking to something to try to get help. Your user can keep it very discreet and keep keep more control. So somebody's pressed the button. We're sending out texts and emails so your people internally know that an incident is in progress. And then our call center will call 911 for immediate police response, or another number you designate if you're managing the response. And one of the key things about our call center, it is an elite call center, and our average response times are very fast. Our time to first action, which is from when the message pops up in our call center to when we're connecting with 911 or the number we call, is 28 seconds on average, which we believe may be one of the best in the industry. And then, I'll just end it with this. It has wearability options. So the user can wear it on a breakaway lanyard, clip it to a belt, clip it to a pocket, even keep it in the pocket with that long 4-second press to send a message. We see very few false alarms, but the importance of wearability is more than just convenience. Just like the act of whipping out a phone to make a phone call, if your user has to dig through a bag or backpack to get to a device like this, it's as much a tell as pulling out that phone. Again, having it on their person, they can discreetly get to the device. They can discreetly activate the alert, feel a little buzz of haptic feedback as the message is being sent, and again, take as much control as they can to ameliorate the situation.
And Mike, I've often heard as well that some of the health and human service workers with their phone, there may be double layers of security on the phones because of HIPAA, right? So it makes it doubly difficult to get into the phone too, right? So you really do that in a hurry.
Exactly. This is, like I said, this is a very simple device designed to do a very small amount of things, but do it very effectively and make it easy for your users. They just charge it, carry it, and hopefully never press the button. That's pretty much the situation. We had a guy who used to work here who said the only training was choosing which finger to press the button. I don't want to make light of it, but it is designed to be so simple that in that volatile situation, your user doesn't have to think. They just have to reach for the device. It's got the buttons recessed so they can feel it, press it until it buzzes, and no help is going to be on the way. So with that, we can answer questions on this solution. And now, I'm very pleased to introduce our featured speaker, Bree Lane. Bree started her career in the Bay Area, helping teens navigate difficult family life obstacles, including justice system involvement, substance use, and mental health. From there, Bree transitioned to working with adults and families facing homelessness and justice system involvement. And Bree now oversees Telecare's mobile crisis response team program in San Diego as the administrator that collaborates with all 11 San Diego County law enforcement jurisdictions, all behavioral health programs in the county, BHS, and the community at large. The San Diego MRCT program has become a nationwide model for non-law enforcement crisis response. And I'll just add here that we've deployed our PERSA solution with a nonprofit that does mental health crisis for the city of Worcester, Massachusetts, based on trying to follow the San Diego model as closely as possible. Well, now Bree will now share some thoughts and insights based on her experience in the field.
Yeah, thank you for having me. I agree with everything y'all have said so far. I think one of the things that stood out is really thinking as a leader, my responsibility is to make sure my teams are safe to do the work. One of the questions I get asked often for mobile crisis is it dangerous? Are you guys safe? And there are risks involved when you're working with someone on the worst day of their life, when they're contemplating hurting themselves or someone else. So we do have a lot of safety training that our staff go through. But I do know, because I have done some surveys with my staff, that they just felt a sense of security. They felt higher sense of safety once we implemented the PERSA devices. When we first opened, we didn't have that online yet. We tried out a lot of different options with other companies, and nothing did what PERSA Vestige is able to do for us. All the features that Michael was talking about, the text messages, the emails, we get all of those in live time with exact GPS coordinates of where the person is at. And it also works in some areas, because San Diego, people don't know this about San Diego, but San Diego does have rural parts. We serve the entire county. And even in some areas where the staff do not have cell phone service, they are still able to press the device, and it still gives us accurate GPS coordinates for where they're at. So us adding this feature to our team was a total game changer in our staff really feeling equipped, feeling safe, and being able to do the work. So I'm going to mainly talk about when do we use it, why do we use it? So, and what I refer to as like action, PERSA in action. So what it looks like for our staff, here's some pictures. They typically will clip it onto their fanny packs that they all wear. And that makes it really accessible. Like Michael was talking about, they have the clip on the back. We also have little carabiners. The device comes with a little triangle that you can hook a carabiner into. That way it could just hang on your jacket, your lanyard. We don't wear double breakable lanyards for safety reasons. Sometimes they malfunction, so we put them on our fanny packs. But really, our team, we're non-law enforcement crisis response. So we go out. My team looks just like the two in the picture. We do not wear bulletproof vests. We don't have tasers. We don't do takedowns or restraints. So we have to use our verbal de-escalation skills to get people to de-escalate. We are able to take people in on 5150 holds. So we have the same ability for behavioral health crises interventions that our police officers do, with the exception of restraints. So we have to do a lot of interaction with members, walking in to really unsafe situations, assessing, are we able to stay? Can we stay engaged? Our teams are trained at the point that they're pushing the duress device. That means there's an imminent threat that they are not able to get their phone out and call 911. We have it set up where as soon as they push that button, it sends the immediate text message to all of my senior leadership, myself included, along with the email. And it has a call into our dispatch center that's manned 24/7 in order to get a police response out. One of the things that I really appreciated when we first started to have interactions and setting this up was the openness that Vestige had in collaborating with us as to what would work best for our model. And they really tailored the capabilities of the device with the notifications for our program specifically. And that was really critical. The other thing that I like to add is we often refer to this is our like virtual ring, our virtual life ring on the staff. So as leadership, we don't always go out with the teams out into the field. We do often, but not all the times. Often I'm sending teams out. I'm back at the station, manning the shift, but I have a sense of security knowing that my staff had this device. If they needed help, they know how to immediately ask for it. We don't have as many accidental alarms or people accidentally setting it off that I was anticipating. So the 4-second hold has been really helpful because we haven't had any accidental pushes where we sent a police car out and it wasn't required. I'm happy to report we haven't had an incident yet where we had to use the device to get emergency services to one of our teams. However, we do just have a peace of mind, the staff have peace of mind knowing that if they needed that support, they have access to it. So that's all for me, and I'm happy to answer any questions people have at the end.
Well, thank you so much, Bree. We will address all questions at the end. And with that, I'm going to wrap this up with just, talking about the PERSA solution. I don't know if this is a repetitive after what Bree said, but again, wearable panic button, silent alarm for greater safety, internal alerts by text and email with location for situational awareness, call to 911 or other number as required. And the benefits, increasing physical safety of workers in the field and in facilities, increasing staff perception of safety for improved staff morale and retention, compliance with emergency preparedness requirements, and greater worker field visibility and accountability if you want to track them using GPS. And one more thing I'll mention before we move over to the Q&A is Vestige also provides camera systems for vehicles. We're in thousands of non-emergency medical transport vehicles where we're looking at things like wheelchair loading, wheelchair safety. And we also have launched body-worn cameras that are beginning to be used in social services. And this is just a little food for thought. We have a child services agency that's using them in New York, and they will record the sessions that their staff members have with some of the troubled youth, just to protect the agency, protect the practitioners from any complaints, and record situations where a client may act out, and just have that documented. And we've more recently deployed with a homeless shelter where the intake people are wearing the cameras as they bring people in and register them for the shelter. Again, just to protect the workers, protect the agency. And our body cams also have the same panic button functionality as our PERSA devices. Again, that's just a little review of what's on our future roadmap and current roadmap. And again, if anybody's interested in that, they can reach out or put questions in the chat. And with that, then we'll move it over to Q&A. Ariel is going to be running that. Do we have any questions in the queue so far?
Yes, we have
Oh.
one that came through for Bree. How would your team use the device, use the PERSA device?
How often?
Yeah, so the team would use it. They have it clipped on them. They have to keep it on their person at all times. We do have a couple of extra ones in the office. That way, if a staff member were to forget it, they still can go out on their shift with like a borrowed one. It is required. So the staff cannot go out into the field without their PERSA device. So they wear it on their person. And we use it for if, you know, I tell my staff, if there's a gun in your face, if there's an imminent threat to you cannot access your cell phone to call 911, you can activate the PERSA device. And so that's how we train our staff to use it. We also train them if they're in an area that they don't have cell phone service and they need emergency services for the member we're serving. Maybe the member is having a heart attack or something's happening. They can push it, which will trigger us internally to get emergency services out to them, even if because they don't have cell phone service. So we haven't, again, like I stated, we haven't had to use it because I am really proud of our robust safety features and triage process that we have in place. However, if that situation, you know, comes up, which I'm sure it's a matter of time, we've done over 10,000 calls at this point, so it's coming, I'm sure, working with humans. We do have that capability to activate the device, and we do frequently do testing on the devices. We'll let everyone know, hey, we're going to be testing out this whole shift's devices tonight to make sure they're still working properly. That way, you know, they feel comfortable using it, they can practice using it.
Okay,
And
fantastic.
I'll add a little bit to that from some of our other customers. We had numerous situations of threats being made and fights breaking out with people in the environment from our clients. And you know, we've seen, I'll give you one example. This doesn't end in anything negative. We had a family services counselor, case manager in with a recently divorced client, and the client's ex-wife showed up thinking the counselor was a romantic partner of the client. She pulled a knife, and they were able to silently, the caregiver was silently able to request help. Police came, they were able to keep it de-escalated until police got there. But we've had other situations where we had one agency where they locked the case manager in a room. The family did and wouldn't let her out. You know, I mean, you can go to the other end of it where we know the kind of things that can happen in the field. You know, I've kept it light here, but you know, those things are happening and our customers are experiencing them.
Great, thank you. Thank you, Bree and Mike. Another question here, what is the battery life on one of these devices, and how long does it take to recharge?
Okay, the battery life is 72 hours. It's actually longer than that, but that's the number that we set. It takes approximately 2 hours to recharge the device. And one of the things we do is if the devices are assigned to named individuals, we can actually send low battery alerts to that user. So I might get a text that says, you know, charge your device, because, you know, if it loses battery, it's not going to be of any use in a serious situation. So we'll notify the user or the supervisor to notify that user that the battery's low. We can also run reports on chronic non-chargers who could be coached.
Can I add one thing to that as well? You touched on
Please.
it, Michael. One thing that's helpful is you can set it up if you want it just to notify the individual person it's registered to, or the person and the supervisor. So we have it where it notifies both. That way, like Michael was referring to, you know, that's for us, that's something we want to address in supervision, because we want to keep safety as #1 priority, and we need their participation to do so. So we check in with them and say, hey, we got 2 notifications the last week that your device was running low on battery. You need to be charging it every day after shift.
Okay. And what is the notification for when there's a low battery? Is it just for the, obviously we have reporting that goes out and can notify the shift, the manager. But what is the actual, does the device buzz or?
No buzz from the device. There's a text to the user's phone. There's an email to the user's account. We don't address it on the device. And we can set multiple levels of low battery thresholds if you want multiple alerts.
Great. Another question here for Bree. What was the process for choosing Vestige and these devices over other options on the market?
Yeah, well, I won't go into my horror stories, but I had quite a few actually. And I'll be fully transparent. One of the things when we first started looking for a device, we went through about 6 different options. And at first, we really thought we wanted a 2-way communication device. And, you know, through horror stories and embarrassing myself in front of our law enforcement partners with really bad call centers, we learned that that actually isn't helpful or useful. We don't really need to hear what's going on scene. We can just trust that if the device is pressed, we need to get emergency services out there. We found with that, opening up that aspect, it was confusing the end users to trying to decipher what was happening, and it was delaying the response. And so we went through about 6 different devices where we would purchase one. We would try them out. We tried out multiple ways. We worked with our law enforcement entities to figure out the call flow. And none of them were doing exactly what we needed to do. Then we found Vestige, and one of the things, you know, like I mentioned earlier, was as soon as I met, I think, Michael, you were one of the first people I met with. I said, look, this is what I don't want, and this is what it has to do. These are non-negotiables. I'm fine if you can't do it, but like, we can't budge. And, you know, we were able to come up with what would work for us. We did initially start with just a couple of devices to test out. You know, we paid a fee and all that. It was very small because I wanted to make sure this was the right device for us. And we tested, you know, Vestige multiple times. Didn't tell them when we were doing it. We had multiple tests we were doing. We went out to the far reaches of the county, tested out the devices, tracked their GPS coordinates, like for a couple months before we said, okay, this is it. This isn't just them trying to sell us on a product. It actually is working. And so now at our program in San Diego, we have 150 employees. And so everyone has an assigned device. Telecare has opened up other MCRT programs that also has the devices now. So this is the way that Telecare is deciding. This is the device that we're using for all of our MCRTs that we're opening up. And we do have other counties, states, other people. The Netherlands has reached out to us to come visit our program. And we tell everybody, like, this is how we do it. This is our process with our address devices. And so we have recommended Vestige to all of the other entities that have come and visited our program, because we just haven't found anything that's worked better. This is really the best product for us.
That's great to hear. Thank you.
If you need me to go to the Netherlands and talk to them about it, I will do that during the summer.
Yeah, I told them the same thing. I said, I am more than happy to come out and, you know, just talk to you in person.
That's wonderful. Thank you. And Mike, this is probably a good question for you. We talked about being able to choose whether or not a notification about the low battery goes to manager, but what are the other customizable options to help make the product better fit the specific needs for the agency?
Yeah, I mean, we've got a system that is almost endlessly configurable. So the device itself is very simple. We have, the SOS press. We can also configure a second button press. And, that has been used for a few different things. One is used in a facility. We can do, a short press is what we call it, and a long press. I'll get into that in a second. The short press is press and hold the button for 2 seconds, feel it buzz, let go. And that can be used in a facility to notify people internally in that facility. Let's say I'm at the front desk, Mike needs a little help up here, but I don't have a situation which needs law enforcement. But if someone walks through the door, obviously meaning to do harm, I can do the long press, SOS press, which is press and hold for 2 seconds, feel it buzz, keep holding for another 2 seconds, feel a double buzz, let go. That will generate a different set of internal messages for by email and text message, and a call to 911. So that's in the device. The device is also a full GPS tracker. So if you want to track everywhere your workers go, how long they spend at each location, did they leave the service area, all of that's possible. And we've got a few social services organizations that do that. Most use it more passively. Like if someone hasn't checked in, they can go see, hey, where's Mike? Or if there's a dispute, a client contacts the agency saying, hey, my care manager didn't show up. Well, they can confirm whether the care manager actually did show up or not to mitigate situations like that. And then in our portal, we have a wide range of reporting. We can report on the different types of alerts by day, month, day, week, month, quarter, or ad hoc reporting if you want to get, how many alerts did we see during this period. And one thing I didn't mention is that with every call that is made to 911, we provide a full after action report with details of when we got the message, who did we contact, what did we say, and how did we leave it with 911. That goes to people in the organization. And we also will call people in the organization after we call 911, give us a list of people who need to know by phone, and we can call, give us names, we'll call until we get somebody, and then move on from there.
Can I give you a quick example?
Please.
So we had a staff member that went missing on the shift, and we were calling, the work phone, the personal phone, and we weren't able to get a hold of them. And we were able to track them because they did have their PERSA device on them. And we actually, they were right down the street from where we were. We went down. They were fine. They just chose to leave their shift. However, they were like, well, while I got caught because I was doing something I wasn't supposed to, they felt a sense of like safety, like we were able to access them and find them. And so that was a feature that we did utilize with being able to keep our staff safe.
That's a great example. Thank you. Mike, I think that wraps us up for questions right now. So if you want to take us out.
Well, with that, then I'll, I'd like to just thank everybody today. Obviously, we're all interested, engaged, and involved in keeping workers safe. You've got programs, you've got this de-escalation training, and, we believe this complements the stuff you're already doing to, again, give a technology solution to making your people safer. And, we're happy to talk to anyone who would like to learn more about this. I mentioned our vehicle cameras, our emerging body cam market for human services. And I'll leave it at that. Thank you all for joining, and everybody have a great and safe day.
And Bree, thank you again, and thank you for everything you're doing with telecare. Obviously, you provide an incredibly vital service. So again, we appreciate and respect everything you guys are doing. So thank you.
Yeah, thank you. We appreciate partnering with you guys. Thank you.
Thank you.
Thank you.
Did you stop? I'm going to stop recording now. Ariel?
If you end the webinar,
Okay.
it'll automatically, yep, stop and then go from there.
Okay, great. And I do know how to edit it for sharing, which we can talk about. But anyway, you may know that too. I'm going to end the webinar now. Thank you.
Okay, all right, thank you.